Good morning, everyone. My name is Gustavo Rivera, State Senator for the 33rd District in the Bronx and Chair of the Health Committee in the Senate, joined by my colleague in the Assembly, Chair of the Health Committee as well, Dick Gottfried. But as is obvious by the content of today's conversation, health is not the only thing that we care about. And we are hosting today a conversation that will be mostly led and really engaged by advocates who we'll be introducing in a second. But we wanted to have this conversation for our colleagues, some of whom will be stopping by. I know that we're joined by Assemblymember Hevesi as well as Senator John Liu. I'm sorry, and Assemblymember Joanne Salmon that just came in. And we hopefully will be joined by a couple of other colleagues since we are literally in the last days, in the waning days of session. Much is going on, so hopefully we will have a contingent of other colleagues joining us. But the reason why we hosted this, even in the waning days of session, is precisely because we know how important this conversation is. The reality is that the changes that are happening at the national level, which will be detailed by some of our advocates, friends here, the changes that have been happening at the federal level, the attacks that have been waged against immigrant communities of all types across the nation have had a direct impact on communities, and they threaten to have even worse impacts on communities. Hopefully what we will do today is have a continuing conversation, since this is something that has been happening in some way, shape, or form, or has been threatened to happen in some way, shape, or form for as long as this administration has been in power. So the conversation that we will have over the next couple of hours, and some of us might need to leave for other things, but this is obviously very important, will be about what are some of the things that are happening right now because of these actions by the national administration, and some of what might potentially happen, and more importantly, what we can do about it, how we can be made aware of what's happening in all these different communities, and how we could fight back and resist it. So with that, I'll pass it over to my colleague in the Assembly, and then our advocates will just get us started. Sir.
Thank you. I think Gustavo has laid it out pretty well. One small correction I might make is that while in many ways the session may be waning, in many ways these days are not waning, but hopefully climactic. Because we've got a lot of things we need to do that a lot of us here are all very much in favor of doing. So let's roll.
All right. And we are joined by, just want to briefly introduce them, but they will obviously be introducing themselves as well. But we are joined today by Maria Caba, who's a Youth Leadership and Advocacy Coordinator for the Children's Defense Fund. We are joined by Dulce Hermida. Señorita Dulce Hermida, she is a member of Make the Road New York. And Madam, please introduce yourself since I don't have it. Yes.
Arlene Cruz from Make the Road New York.
And Arlene Cruz from Make the Road New York. And last but certainly not least, Ms. Carolyn Cowan to my left, Chief Policy and Public Affairs Officer of the Chinese American Planning Council. They will all walk us through what are some of the things that are happening, what are some of the things that we can do. And Ms. Caba, I'll pass it off to you.
Good afternoon, everyone. My name is Maria Caba. I am the Youth Leadership and Advocacy Coordinator at the Children's Defense Fund New York. In my role, I oversee a scholarship program for high school sophomores who have overcome tremendous adversity, yet are committed to their education and social justice issues. And I'm here today to speak on the public charge rule that was leaked. And my commitment to advocating against this rule is not just a professional one, but also a personal one. I'm originally from the Dominican Republic, and when I came to this country, I was 2 years old, and I was undocumented. Unfortunately, due to misinformation, I was misguided, and I was told that I was not eligible to adjust my status, although since the age of 8 years old, I was eligible. And I didn't find this out until my 20s, right? And so I lived in this country for over 15 years without access to critical services and resources because of misinformation, right? And so I'm an advocate for making sure that our communities are educated of their rights, right? And the truth is, if this policy, if this rule was to go into place, it would have a chilling effect in our community. Children, particularly vulnerable population, right? Families of color, poor families would be discouraged from going out and seeking services that they have a right to, right? And so we have to make sure that we're educating them about what's going on and what they have access to and what they have a right to. And so in 5 days, I'll be eligible to naturalize. Thank you. And that's amazing, right? It really is. For such a long time, that's all I ever dreamed of. Actually, one of my dream job was to work for the FBI, right? And so when I found out I was undocumented, that became unattainable. But it's so unfortunate because as I reflect on when the rule was leaked and as I was reviewing the negative factors, the truth is if this rule would have been in place, I would have been denied my green card, right? And so that's something that's really important to say because here I am a year and a half away from applying to law school, working at the Children's Defense Fund, working to empower my community, yet if this rule would have been in place, I would not have this opportunity, right? And so the truth is that my story is not unique. It's very common. Through my work at Children's Defense Fund and as an organizer, I have come across with countless of New York City youth who say that their families are afraid to reach out and see if they are eligible for some type of help, either to provide education, food, housing, right? And so the truth is, our communities are afraid. Our communities are misinformed, and it is our job to protect these young people and these families and these children, to push young people and families to decide whether to provide housing or education or food, putting food on their table, or receiving some form of immigration status is plainly barbaric, right? And we need to do better to make sure that we're protecting our children and our families, that we're not pushing them further into the shadows. And the truth is, there is so much that we can do, right? As community organizers, we can go out and we can try our best to inform as many people as possible, but the truth is we need help and support from our New York State legislative. And so we're here today to inform you that this is a policy that potentially can affect thousands and thousands of children's life negatively, right? They will be further pushed into poverty. They will be disencouraged from reaching their academic successes. They will be going hungry. They will be having lack of health services if we don't do better. And so thank you so much for allowing me to be here today to share my story and to share the story of, frankly, of the community where I come from, which is, you know, a large percentage of our New York State community. Thank you.
Dulce.
Mi nombre es Dulce Hermida y soy miembro de Make a Road to New York. Durante muchos años no tenía seguro médico porque no cumplía con los requisitos de elegibilidad debido a mi estatus migratorio. En el 2010 sufrí un accidente que me dejó gravemente herida. Durante ese tiempo no pude obtener los seguros médicos de salud necesarios porque no tenía seguro médico. Y como madre soltera de 2 hijos, y el tiempo y el dinero eran muy limitados.
Good morning. My name is Dulce Media. I'm a member of Make the Road New York. For many years, I did not have health insurance because I did not meet the eligibility requirements due to my immigration status. In 2010, I suffered an incident that left me seriously injured. During that time, I could not get all the necessary health services because I did not have health insurance, and as a single mother of 2, time and money were very limited.
Muchas veces cuando no tenía seguro, demoraba recibir los saludos debido a los largos tiempos de espera para una cita y porque significaba sacrificar un día de trabajo sin pago. Tuve que priorizar el trabajo para mantener a mis hijos. Ahora que tengo seguro médico, tengo un médico designado que entiende mi salud, puede ver a un especialista, acceso a recetas y a tranquilidad de saber que tengo cobertura en caso de una emergencia. También significa que finalmente puedo tener acceso a los servicios médicos que había rechazado y recibido durante años atrás.
Many times when I was uninsured, I delayed receiving necessary health services because of long waiting times for an appointment, and because it meant sacrificing a day's work without pay. I had to prioritize work to support my children. Now that I have medical insurance, I have a designated doctor who understands my health, can see a specialist, access prescriptions. I also have peace of mind knowing that I have coverage in case of an emergency. It also meant that I could finally access services that I had delayed receiving years ago.
Cuando escuché por primera vez el anuncio sobre la carga pública, estaba nerviosa y asustada porque no sabía qué significaba para mí. Esto en el proceso de cambiar mi estatus migratorio, y pensé al principio que, como podía ser considerada como una carga pública bajo la propuesta. Yo, como muchos en mi comunidad, estaba desesperada y pensaba en descontinuar la inscripción de los seguros de salud, SNAP, UI y otros beneficios para nosotros y nuestros niños, porque no queremos correr el riesgo de ser una carga pública. Inscribirse en los beneficios públicos es difícil para la comunidad de inmigrantes y muchas veces estamos desesperadamente necesitados cuando finalmente presentamos la solicitud. Escuchar sobre la carga pública creo que es una de la adición de miedo que tendrá un efecto durante, incluso si no se publica una nueva regla.
When I first heard the announcement about public charge, I was nervous and scared because I did not know what it meant for me. I am in the process of adjusting my immigration status, which I thought meant that I could be considered a public charge under the proposed rule. Myself, as well as many others in my community, were in despair and said that we were going to disenroll ourselves and our children from health insurance, SNAP, WIC, and other benefits because we couldn't risk potentially being a public charge. Enrolling into public benefits is difficult for the immigrant community, and oftentimes we are in despair need when we finally apply. Hearing about public charge created an additional layer of fear that will have a lasting effect even if a new rule is not published.
Afortunadamente, soy miembro de Make a Road to New York y la organización se puso en acción inmediatamente y comenzó a educar a la comunidad sobre nuestros derechos. Las reglas propuestas, aclaró quién podría verse afectado y cómo hacer comentario en contra de la regla propuesta. Si la regla entra en vigencia, nuestras comunidades de inmigrantes sufrirían aunque se vean afectados o no. Esto significa jóvenes y adultos documentados e indocumentados de todos los demás. Al igual que yo, los padres con hijos ciudadanos nacidos en los Estados Unidos e incluso personas con residencia permanente actualmente están enrolados en sus familias de beneficios muy necesarios para sobrevivencia debido al temor.
Thankfully, I'm a member of Make the Road New York, and the organization jumped into action and immediately started educating the community about our rights, the process rule, clarified who could potentially be impacted, and how to make comments against the proposed rule. If the rule comes into effect, our immigrant communities will suffer, those directly affected or not alike. This means everyone young and old, documented or undocumented, and everyone else in between. Just like me, parents with U.S.-born citizen children and even individuals with permanent residency are currently disenrolling their families from much-needed survival benefits because of fear.
Después de enterarme de mis derechos, tenía suerte aprender que yo soy actualmente uno de las categorías exactos y no estaría afectada por medio de este cambio en la regla de la carga pública. Sentí un alivio de inmediato y decidí continuar usando mis beneficios. Me pregunté, ¿qué sucedería si tuviera que elegir entre ajustarme a mi estatus migratorio y tener un seguro de salud? ¿Cuál elegiría? Pienso en los servicios de salud que necesito con urgencia y no puedo imaginarme en un mundo en el que no lo tengas. También recuerdo en el momento en que tuve beneficio de NAT para mis hijos y cuando no ayudó en un momento necesitado. Últimamente no puedo decidir hoy cuál elegiría porque todos son igualmente necesarios para poder progresar. No es justo hacer que nuestras comunidades elijan entre estar saludable o poder cenar o tener un techo sobre sus cabezas. Hoy les pido a todos que comprendan qué significa todas esas posibilidades para nuestras comunidades, como el miedo está aumentando, la pobreza, y ahora más que nunca necesitamos que el Estado responda y brinde apoyo, aumente el acceso y los beneficios financiados por el Estado, crear mensajes claros que nos eduquen y nos capaciten para ampliar los servicios legales de inmigrantes y los esfuerzos de educación proporcionada por las organizaciones como Make a Road to New York, que está para ayudar, para informar, para apoyar, para educar a la comunidad. Gracias.
After learning about my rights, I was fortunate to learn that I am actually in one of the exempt categories and I will not be affected by a change in public charge rule. I felt immediately relieved and decided to continue using my benefits. I asked myself, what if I had to choose between adjusting my status and having health insurance? Which one would I choose? I think about the health services that I direly need and can't imagine a world where I would have to go without. I also look back at the time when I had SNAP benefits for my sons and how much it helped us in a time of need. Ultimately, I can't tell you today which one I would choose because they are all equally necessary for progress. It's not fair to make our community choose between being healthy, eating dinner, or having a roof over their heads. Today I'm here asking you all to understand that what these ifs and possibilities means for our community, how fear is increasing poverty, and now more than ever, we need the state to respond and provide support. Increase access to state funds benefits, create a clear message that both educates and empowers us, and expand immigrant legal services and education efforts provided by those organizations most trusted in our communities. Thank you.
Ms. Cowan, the floor is yours.
Good morning, everyone. My name is Carlin Cowan. I'm the Chief Policy and Public Affairs Officer at the Chinese American Planning Council, CPC. CPC is the nation's largest Asian American social services agency. We work with over 60,000 Asian American, immigrant, and low-income New Yorkers each year throughout all 5 boroughs out of our community centers in Lower Manhattan, Flushing, and Sunset Park. In the last 10 months since the draft rule on public charge has been proposed, it has already devastated the community members that we serve, and as we prepare for the potential for a final rule to drop in the coming days, weeks, or months, what we have seen in our communities is hopefully going to inform how we can respond and best be prepared to protect immigrant New Yorkers if a final rule is published. In the media, a lot of what we talk about on public charge is that it's an issue that impacts primarily Latinx communities, but the reality of that is that it impacts all immigrant communities, and that when we only talk about the potential impacts on Latinx communities, we underestimate the potential devastating benefit on all New Yorkers. The Urban Institute recently published a study showing that 1 in 7 immigrants is already withdrawing from benefits, but that study only looked at Spanish-speaking and English-speaking people, not immigrants that speak other languages, which means that the impacts on Asian Americans and immigrants speaking other languages is being hidden, and that the true impacts of what it could have on all New Yorkers may be being underestimated in a significant way. And we've seen at CPC that this is a huge issue in the Asian American community. Asian Americans and Pacific Islanders are the fastest growing population in New York City, representing 15% of the population, 10% of the population in New York State. 1 in 7 Asian Americans is undocumented. Asian Americans are the most likely to live in mixed status families, which is a big deal when it comes to public charge. 70% of Asian American New Yorkers are limited English proficient, and 70% are immigrants. This means that we have a community that is very likely to be impacted by public charge. When you consider that with the fact that 20% of Asian Americans live under the poverty line, and that 48% lack the basic income to make ends meet, we have a community that we serve at CPC that is very likely to need benefits, and Asian Americans are actually the highest level of eligibility for public benefits, yet the highest level of under-enrolled for public benefits. So we already face a struggle enrolling our community members in benefits that are needed, and public charge is making that even more difficult. In the days immediately following the draft rule, we already saw the impacts at CPC. We had community members coming in, filling our waiting rooms, trying to de-enroll from their benefits. In the weeks after, as the media began spreading misinformation, our waiting rooms were empty as we saw that community members were not coming in to receive services out of fear. The impact on our community members was immediate, and we launched a rapid response at CPC. We did a train the trainer model to train our 700 staff on how to answer community members' questions. You'll see in your information packets a copy of that training to answer community members' questions as we encourage community members to remain in their benefits until anything had changed, and how to find good legal support and avoid fraudulent legal support, which has also been a really big issue within the Asian American community. The chilling effect has already been seen on this over the last 10 months. We have seen a 20% drop in enrollment in SNAP at CPC. That is much higher than the citywide average that's been reported by the Mayor's Office of Immigrant Affairs at 10%. But we've seen that so far, and we anticipate that if a final rule is published, that this may become even worse. As a context, we saw that the Fiscal Policy Institute put out an estimate that showed that if 15% de-enrollment happened, that the impact on federal funds could be $1.1 billion to New York State, and the total economic impact could be $2.1 billion to New York State. And if we're already seeing a higher level than that at CPC, then the concern is what might happen when a rule is finalized. And the human impact of that is very real as well, because we have seniors that we know rely on their SNAP benefits, on their housing benefits to make ends meet. And they, despite all of our best efforts and our training that we've done, have been trying to de-enroll or not enroll in new benefits out of fear that it might impact their family members. That means people on a daily basis are making a very real choice about not getting the benefits they need to eat, to remain in their homes, to remain healthy, and we haven't even seen a final rule published yet. So as we prepare for a potential final rule to be published, I hope that some of the lessons that we've learned in the response to the draft rule can be implemented. And those are a few that we've seen at CPC. The first is that we need to respond immediately and be prepared to respond before anything happens, because word spreads quickly about this. That means that staff need to be prepared to inform community members of what the issues are, whether it might impact them, and then refer people to the legal services they need. The reality of it is that a lot of community members that come in are not necessarily eligible for the public charge test, but experience those fears anyway. And when we see that legal services are already overstretched, there's not a single Asian American legal services provider in New York City or state, we need to rely on community-based organizations to do that triaging, dispel misinformation, and make sure that people that could actually be impacted are referred to legal services. We also need to do education and outreach and counter misinformation in the media. We saw in the first days after the draft rule was published that in Tsingtao, one of the popular ethnic media publications, an advertisement was published telling people to de-enroll from their benefits immediately, which led to people coming into our community centers and trying to do so. Because our staff had been trained to keep an eye out for misinformation in the media, we were able to publish a correction in that media, but of course, in a lot of ways, the damage is already done. The next is that language access is key. We saw that a lot of people, because of language access issues, trusted misinformation rather than real sources, and that the information that the city provided was not necessarily fully translated, and so community organizations had to fill the gap. We have to be prepared to have fully language accessible information, resources, and services. And then the final one is just making sure that there's coordination at all levels between the state, the city, community-based organizations, advocacy organizations like the New York Immigration Coalitions and others. That's why I think it's so important that this briefing is happening today, and we look forward to continuing to work with all of you to respond as this progresses.
Thank you, Ms. Cowan. We will now have a review of the public charge rule and federal policy updates. Ma'am? Use that microphone right there. Yes, ma'am.
Good morning, everyone. Can everyone hear me?
Yes, ma'am.
My name is Claudia Calhoun. I'm the Senior Director of Immigrant Integration Policy at the New York Immigration Coalition. And you've already heard the stories of the impact of the Department of Homeland Security proposed public charge rule. What I'm going to do is I'm going to walk through some of the technical context, and it gets a little wonky, but it's actually really important to understand that we are not just looking at a Department of Homeland Security proposed rule. We are looking at a coordinated attack on immigrant communities across the federal administration. And there are numerous things just as grave and even scarier for immigrant communities that are potentially coming. And so we want people to understand as we prepare for the Department of Homeland Security rule, all the other things that the state of New York is going to have to contend with if the administration is successful. So just to orient you a little bit to what you've heard about the chilling effect, you've heard about the fear that immigrant communities feel. I'm going to walk you through exactly what it is that was proposed to happen. The federal government is trying to reorient and sort of redefine the idea of public charge, which is a very old idea in American immigration law. From someone who is primarily dependent to someone who is likely at any time to use or receive public benefits. That is a really big distinction. They are trying to change they are trying to use public charge as a tool to target people who ever use any kind of public benefits. In the proposed rule, we know that people would undergo, right now public charge is something that happens when you apply for a green card, you have a public charge test. The proposed rule would also increase it to when someone applies to a renewal of a visa. The public charge rule would shift emphasis to the individual characteristics of the person who is applying. And there's the USCIS is supposed to look at the totality of circumstances of that person. One of those things that has always been considered is the affidavit of support that a family member who is sponsoring them signs, and that person's financial well-being. The proposed rule would minimize that and focus much more on the specific circumstances of 5 factors related to the individual who is applying. And really what this means is it gives USCIS much more latitude in focusing, in really like targeting and penalizing low-income applicants. It makes it really, really hard for someone who is low income to not be viewed as a public charge. Public charge is a thing we've had to contend with for a long time. It has always been part of immigration law in the United States. Since 1999, the only programs that trigger public charge consideration have been cash assistance. So that's like TANF or New York State safety net funding. So that's money that the family actually receives, not food stamps. And institutionalization for long-term care that's paid for by Medicaid. So that's where someone is in a long-term care facility. The proposed rule would add food stamps, regular Medicaid, not emergency Medicaid though. Yes?
I don't want to interrupt. I have a question about something you said. Is this appropriate or do you want to?
Let's wait till the end.
Go for it.
Thank you. The Medicare Part D low-income subsidy and public housing and Section 8 assistance. So these are the programs that allow families to get through their month, to allow families to be economically sustainable. And you've already heard the impact that that's had, people being concerned about the impact of what it means to continue using these life-saving, sustaining programs if it makes it harder for them to establish status here in this country. I won't go into this. I think you've heard both the qualitative and the quantitative side of the chilling effect, except to say that we know that HRA has seen that there is a pronounced difference in use of food stamps in non-citizens relative to citizens, and they've looked at this over time. And as Carlin pointed out, you also have additionally subgroups of immigrant communities that are even more affected by this chilling effect. For example, the rate of, I already said this, so I'm going to keep going. Okay, so now what I'm gonna do, that's all the DHS proposed rule, and that's all related to the Department of Homeland Security final rule that we anticipated. We've heard rumors from our partners in Washington that it could be now, or it could be over the summer, or it could be in September. So we are in watching and waiting and preparedness mode, and we are really grateful to the legislators here, the elected officials here, and their staff who are working with us on doing that. In addition to the DHS rule, there is also news reporting, and it has also been communication that there is also a Department of Justice public charge reportability proposal that is in the works. And so what that means is, we heard about this on May 3rd from Reuters, and it sounded like the reporter had actually seen a draft of the rule. It wasn't leaked to the public. But it would interpret public charge and inadmissibility, and that means that if someone is inadmissible, they cannot be here in the United States, and they could potentially be deported. The way it's worked up to now, it's very, very difficult, such that you never see someone being deported because they've been designated as a public charge. It's a very, very narrow and very, very high bar for the federal government to meet. But this would change that, and this would make it much easier for the federal government to designate someone as a public charge and take steps to deport them from the country. We don't know a lot more than that, but we know from what you've heard from these stories, we know that this is terrifying. This is really a visceral threat to, it is a means to separate families. It is a way to make sure that people step back or refrain from using any benefits. It will push families into extraordinary financial vulnerability and poverty. So that's the DOJ rule. Another rule from another agency that we are also concerned about, and we are in a different stage because we actually are in a public comment period, is the Housing and Urban Development Rule on the verification of status. And this is something that was proposed on May 10th, and we are working with our partners both in New York and nationwide to generate a comment response as well, as we did with the DHS rule. There's a 60-day comment period that ends on July 9th. So as of right now, only U.S. citizens, legal permanent residents, and some other qualifying statuses can be eligible for Section 8 or public housing. But mixed status families are allowed to live together, and the non-eligible household members pay their pro rata share of rent out of pocket. So that is a very technical phrase. What's important to know is that undocumented individuals do not receive public housing benefits. They may live in a family where people are eligible for them, and they do receive them, but the size of the space that the family lives in and the amount of contributions that the family makes is only based on the eligible individuals in the household. This would seek to target those specific families and evict them if there were mixed status families living in public housing. The other way that this will affect low-income people in general, immigrants and non-immigrants alike, is that every individual that lives in public housing may be asked to verify their status. So this will be a really serious challenge for individuals who are elderly, who may not have their birth certificate or may not have a passport. It will be a real incentive for families who are eligible for public housing not to seek it, and it could potentially push them into the shelter system. And this rule, like a lot of these rules, affects a pretty narrow group of people in a technical sense, but it affects sort of anyone who has any concerns about their status or any concerns about the status of their family members based on a chilling effect. So we expect that the impact of this will be broader than simply the families that technically are the target of the policy. So that's the HUD rule. Another thing that happened just last week is on May 23rd, President Trump issued a memo that requires sponsors of immigrants to reimburse the government for public benefits used by the person they have sponsored. This is something that is addressed to the agencies. They need to submit a plan to the federal government in 90 days to update their guidance. And what it means, we don't know exactly what this will mean in practice. It may vary from agency to agency. But it, again, you see that it is a fear tactic and an attack on immigrant families using benefits that they're eligible for by making them afraid that their family member is going to go into debt on their behalf. And then the last thing is not specific to immigrants, and it hasn't gotten much press, but it's really important to understand because it's going to affect low-income populations for years to come if they are successful in implementing this. The Trump administration proposed a regulatory change that would use a lower measure of inflation to calculate the federal poverty guidelines. The take-home here is it's going to be harder to be considered poor. The threshold at which someone is going to be considered poor is going to be lower. There's going to be more people outside of that threshold. They're still going to be struggling economically. They're just not going to have the designation as under the poverty level, and that's going to change their eligibility for benefits. So this is just a really cynical ploy to retain as much benefits to take away as many benefits from as many people as possible. If it goes into effect, it will have an impact on a few tens of thousands in the first year, but over 10 years, it would affect millions of people because of the way that inflation works and the way the cost of living works. Okay, so what we want people in this room to do and what we are working to make sure that we are supporting fall into some broad buckets. One is that we're going to need to fill the gaps. We're going to need to work together as advocates and service providers and elected officials to make sure that people don't experience hunger, that people continue to seek care, that people are not pushed into the shelter system because of that. That is going to require massive sorts of investments and very clever policy making to protect immigrant families. A good example of this is in New York City. New York City has very good protections. It's very hard to evict someone from public housing, and so that will create, we've talked to housing advocates, and that will create some protections, and it will slow the process of people being pushed out. But people in other parts of the state won't necessarily have that protection. Thank you, Senator and Assembly Member.
Yes.
Good luck.
Conference, but
Yes.
you know where I'm at.
Thank you. Carlin made the point that access to legal services is going to be critical. All of the people who have concerns about all of these things, there aren't legal service providers who have the capacity to sit down with everyone and talk to them on an individualized basis. As much triage as possible and as much community education in a way that can be reassuring as possible is going to be critical. And so access to legal services, supporting of hotlines, supporting of sort of large-scale information dissemination tools is going to be key. CBOs are the organizations that can do this work. CBOs need capacity. This is an onslaught. This is a dramatic wave of different attacks. And CBOs need all the resources that they can to understand the policy and be able to participate in provision of services. And finally, we need data, we need analysis, we need all of we're going to talk to agencies in the afternoon. We need to understand that we need more analysis like what HRA put out and what Carlin talked about today. We need to understand the impact that this is having on different individuals. Okay, and so with that, we'll take questions at the end, but I'm going to turn it over to my colleague Susan Welber from the Legal Aid Society.
Thanks, Claudia. And thanks to the Assembly members and senators that are here and to everyone that's here. My name is Susan Welber. I'm an attorney at the Legal Aid Society in New York City in the Civil Practice Law Reform Unit. And I'm primarily here to talk about what are we doing about this? How are we responding as advocates? And what can you do, those of you who represent different offices, what can you do to help us and to help your constituents? As I think that Maria and Dulce so beautifully expressed and so concisely expressed, the public charge rule in particular affects a very broad swath of our communities. It affects people who are actually in the process of trying to get their green card and become an LPR. like Maria was, and would stop someone like Maria in their tracks and deprive us of Maria and people like her, people who are here in the United States to contribute and to build a better life for themselves and for their families. It affects people like Dulce and other people that she referenced who are not subject to public charge, but because the rule is so technical, think that it applies to them, and then forego benefits that are critical to their health, to their nutrition, and to the health and nutrition of all of us. And finally, it goes to family members of people like Maria and Dulce who are U.S. citizen children in many cases, who are eligible for these benefits, who need these benefits, and because of the perceived risk to their parents, are foregoing these benefits. So it's really a huge threat. And the Legal Aid Society, with its mission of helping low-income people generally and immigrants in particular, it's something that we're duty-bound to do something about, as all of us are. So what are we doing? Well, on the one hand, we're just trying to advise people as to which category do they fall into. Are they actually subject to this rule where they do have to make a choice potentially between benefits and their immigration status, or are they experiencing what we call the chilling effect, where they really just need information and counseling to understand that the rule doesn't apply to them and that it's safe for them to continue to use benefits and for their kids to use benefits. So we're counseling as many people as possible, as are the other advocacy organizations that are in the room. In particular, the Legal Aid Society, Empire Justice Center, and Make the Road New York have put together a screening tool. There are copies of it on the table there, and we're in the process of turning it into like an app to make it really readily available to lots of people that will help you and your constituent-facing staff and other community groups determine which bucket does the person they're speaking to fall into. Are they potentially subject to public charge and therefore need a referral to a legal services organization like Legal Aid? Or are they experiencing the chilling effect, in which case it may be enough if you're armed and your staff is armed with the information that they need, that they can explain to the person that they can continue to receive the benefits and their kids can continue to receive the benefits without concern. Absolutely, absolutely. We'll definitely get to Assemblymember Hevesi's questions. I can almost anticipate what they might be, I think. But before we go there, so we're doing outreach and counseling. We're also considering all of our other options. And just like so many of the Trump policies affecting immigrants, ultimately, this one may only be stopped by the courts. And so we are fully engaged in that process, along with other partners here in New York and across the nation, preparing to stop this in the courts. But the truth is that even if we stop it in the courts, best case scenario, we get an injunction making sure that it doesn't go into effect, it's not going to change the fact that there are still hundreds of thousands of people who are scared and may forego benefits. And so what this rule really requires, just like so many of the administration's rules, is really careful public knowledge. So I think that Claudia laid out all the different forms of assistance we can use from the state, but one in particular is just being sure that you're addressing your constituents' needs, and to the extent you need any of our assistance in doing that, we are really available to assist you. On the HUD rule, I also want to mention that the Legal Aid Society, along with other groups in this room, is working on that. We're also considering all of the options in terms of how to fight that back. Right now, that's in the public comment stage, and Legal Aid is working on a set of comments that are specific to the impacts in New York. And we are going to make that available to all the Assembly and Senate members so that you can have your voice heard on behalf of your constituents on that very important issue. Because I think it's at least 25,000 families that are affected by that, and I think the last estimate was 55,000 U.S. citizen kids in those households. So that's a little bit about the advocacy that we're doing, and we're very happy to answer questions. Assemblymember Hevesy, what is your question?
I have three.
Great.
Is that okay? I'm only allowed one.
You sponsored this.
I did.
Yeah, your name is on it.
So a couple of points. First, thank you. And thank you. So just a general point that I have not been able to drill down on. Is safety net assistance part of the public charge, part of the programs that can have you deemed a public charge? It's important to know if it's just TANF or if it's safety net as well.
Yes, unfortunately, it is state-funded cash assistance.
How do you do that?
And that's actually the current rule. That's the current rule, that if you're receiving state-funded cash assistance right now, you are theoretically subject to public charge if you're in the precise immigration posture where it affects you. But if you have a really a sponsor that meets the financial eligibility criteria, you don't have to worry about it as much.
What if it's not cash assistance? What if it's for housing assistance? What if it's you?
That's what I thought you were going to ask. Yeah. Well, the current rule says that non-assistance that doesn't go to like your money you have in your pocket for spending, so rental assistance does not count. So even though our shelter allowance and the utility allowance, because they go straight to the provider in many cases, there's a good argument under the current rule that's not, that the one that's still in effect, that is okay. So that all of our housing subsidies that are based on the receipt of cash assistance right now are okay. Under the new rule, we're certainly arguing that they do not trigger public charge under the new rule, but for those families that are in the process of adjusting, it may be a problem for them.
So then another technical question on that point, can a public assistance recipient in their household receive just the utility portion and shelter allowance portion without taking their cash benefit?
That's a great question, and that's one that we're actually getting ready to ask the agencies, because that would be a way of really stemming the harm to a certain extent.
Okay. And then if anybody else has questions, they can jump in. Can I just roll?
Yeah, they're good questions.
Okay. First of all, I didn't think they could get any worse. These guys are really terrible, so I just want to pine on this. This is really evil, genius type stuff. The analysis that you're doing about the families that are going to be hurt through the HUD proposal, it would make sense for the state for us to look into, isolate the, you said 55,000 kids, however many families, and try to get them into one of the state's programs for rental assistance to sort of, fill the gap for whatever they're losing in HUD, they're sectioning it, or any other HUD placement. We should try to fill the gap at the state level. So if you could identify that population, that's something I think we should look into, so they're not hurt.
Other
They would-
colleagues of mine at Legal Aid are working on that, but I will put them in touch with you to discuss what other, ideas there may be out
And
there.
then the last one, if I can, it's not even really a public charge, it's a division of poverty. That's outrageous. The poverty level is ridiculous in and of itself. It was created in the 50s. So, nobody knows what do we do about that?
And it's
That's
really,
also-
yes.
That's American citizens, that's everybody.
Yeah.
We gotta kill somebody, I'm sorry, something has to happen. I was kidding about killing somebody.
It's also a double-edged sword in terms of the public charge rule, right? Because if we say, oh, our clients are really living in poverty, we'll say, see, that's the problem. So it's really evil, as you put it, and we just have to fight it with everything we have.
Can you just get us information about it so we can fix it? No, I didn't know about this.
Yeah, that's why New York immigration
Comment
rules.
period ends next.
June 21st.
Yeah.
June 21st.
So you were talking, with regard to that, one of the things that I've done a lot in the past is, writing comments on federal rulemaking, and there's another thing coming out tomorrow from CMS on the ACA, which will undoubtedly be horrible. So, you know, who knows what we're doing next week in the legislature, how long we'll be. But if we can get members to write and file comments, right? A lot of times it's easy for us to do that as a group thing, but you really want to increase your numbers. So from a strategy, do you want, 150 assembly members? You're not going to get 150, but 107 assembly members to write comments, even if they're very similar. If there's a model we can use or a way that we can help kind of push that and get those filed, does that help?
Yeah, I think Claudia and I both have thoughts on that. Claudia, do you want to start?
Sure, the question was, were you asking the question in regards to the poverty guidelines specifically, or both? Or
It's
sort of
just
all?
about commenting.
Yeah,
You
okay.
get one set of comments due next week, which is the HUD.
No.
July 9th
Oh,
is
the
the
poverty
HUD.
guidelines, okay.
Yeah.
And the HUD one is due in a couple of weeks too.
The HUD one is due on July 9th, so you have more time for that one.
Maybe a little bit more on that.
So, I think there's answers for, I think for the HUD rule, we absolutely want comments, and we can definitely make the comments that we draft available, which we'll draw from the national advocates that know housing stuff. And also, I should say, there's going to be when the Department of Justice proposed rule on deportability comes out, they will have all of the same oversight requirements that DHS did. And so there will be a proposed rule and a comment period, and then they will have to review the comments, and then there will be a final rule. So there we would want comments too. My understanding from national advocates on the poverty guidelines rule is that is probably there's not as much of a need for sort of a real groundswell, because highly technical comments that are really specific to some of the economic impacts of tying that to a different calculation of inflation, those are going to be more useful. But if you are very interested, I can definitely put you in touch with the national advocates that we're getting feedback from, and to see how you might be able to help. And
Can I just add one thing to that? So, we learned in the public charge comment period, where we were able to get 266,000 comments from across the country submitted, that they only count them if they're about 2/3 unique. So I think it's really valuable for all of the assembly members and all of the senators who care about this to submit comments, but you might just want to, and we can put this in our materials that we give you, you're going to have to put a little bit about your constituents and the community that you serve. And even if you don't, it's a really great tool for getting the word out.
And to the extent you have data or viewpoints on the effect on women and families, for example, so we can get women's caucus members maybe to focus their comments on the effect on women, and the same thing for people with disabilities. That's another big issue and a big area that there's a lot of overlap there, but if we can help focus those comments a bit.
that would be great. That's great.
I do want to add that Ben Anderson from Children's Defense Fund New York, I do want to add something on the poverty public comments. Our national partners are also saying with that particular public comment that organizations and anyone commenting should refrain from putting specific data around the impact to states and communities because of the way that the comment is being proposed. It will preserve certain legal arguments down the road to challenge any change. So this is the one time only where don't put in sort of the numbers for the district or the county or the state. So just wanted to mention that.
Good point.
Yeah, just wanted to mention, so I'm for the public comment. I appreciate that I've done it in the past, but I don't think colleagues have a sense that this is happening. I haven't heard anything from our congresspeople. What I'd like to do is not do it through a comment to the government, but in another form, to let all of our colleagues know, maybe a letter they can sign on to the president, we've done that before, something else outside the comment period where we're not as restricted, to sort of let everybody know that this is imminent, particularly with the poverty guidelines, because that's outrageous, and that affects, look, we're here about the public charge, that's what we're all believing, this is also about American citizens. So it's, I
As
think
is
we
the
gotta
public
find that
charge, I
balance.
mean, all of these policies affect all of us, it's really.
Yeah,
And they
so-
layer
so
on
my-
each other.
What's that?
And they layer on each other. They're
They
all
do.
interrelated.
So my instinct is, well, we're doing things for the comment period to go bigger, and try to get a bigger audience of elected officials and congresspeople involved as well. So we would need information from you about what exactly the proposal is, and then Joanne and I, and we can get our colleagues to work through the politics of it. Would that be acceptable?
Yeah, I think we
You guys
all
cool
love
with
that
that?
idea,
You
yeah.
guys cool
And
with that?
Ben, you
Yeah,
wanted
Did
to-
something stupid.
Somebody can have a seat. I think that's a fantastic point, and the timeline is also different from that than the public charge timelines, because members of Congress can weigh in sort of later. They don't have to meet these deadlines that we're giving.
Yeah,
guys.
look, I just don't think many people know, I didn't know about it, so I'm imposing my lack of self-knowledge on everybody, but I haven't heard of people about this, and I don't know it's in here, so. Okay, great, so look forward to working with you guys on it. Thank you.
Any other questions that any of the panelists can answer?
Yeah, one other question, do you have any sense of, if there's anything we can do about the portability piece?
I mean, I think we'll want to undertake the same kind of response. So when that is posted, we will certainly be back to talk about that and making sure that your partners, your legislative partners here are in the room, or their staffs. Were you asking about timing, or were you asking about strategy, or?
Yeah, what's the fix on that?
I think the other thing for all of these rules, and I'll try to review, is that there is federal legislation to block funding of the public charge rule, and there is, I think, also now a bill to block funding of the HUD rule, and so certainly that will be part of the strategy. And I legal aid probably must have.
I mean, you know, we think litigation is really important. I do want to just point out, not to be a total downer, that, you know, the DHS, more of a total downer, that the DHS rule is about people adjusting to green card status, and the DOJ rule, as Claudia pointed out, is about deportations. But the truth is that the DHS rule is also about deportations, because if someone applies for the green card and gets denied because they're a public charge, that family is going to be separated. That person who's denied is going to be deported. I mean, that is the way it's all been set up. So they're really already very close to putting what we're thinking of as the DOJ rule, which hasn't been introduced yet, into effect in this other way. So it's really bad. It's urgent.
All right. Do we have any other final questions? All right, I really want to thank all of our legislative partners, and I really want to thank the panel that came together on very short notice to put together a really wonderful program and a really wonderful agenda. And thank you to all the advocates that contributed to our framing and narrative and polish. And so I think that we're very grateful to have allies here working on this, and we'll look forward to continuing the conversation.